Welcome to Island Hope International's Life Series, where we live it fully every day. I'm your host, Alicia, and today we're joined by licensed clinical social worker and mental health therapist, soon to be Dr. Shaynor Ishmael. Today we're discussing maternal mental health and COVID-19.
Right now! Come here, you! Don't ask calling you! Up, up!
Life is what you make it. So come here, my dear. Try and make it. I know that you will.
Well, thank you for taking the time to join us today and discussing mental health, especially as it relates to maternal issues. This has been a very important component of health, yet historically it's undermined until recently, where we're now realizing the importance and its equity in the whole scheme of things. In the West Indian culture, it's a very taboo topic. But before we get into the nit and gritty of everything, tell us a little bit about yourself.
Okay, so my name is Shaynor Ishmael. I am a licensed clinical social worker in the state of Florida. My background is more in the medical field, so I spend quite a lot of time working on neonatal high risk. I've worked on the high risk unit. I've worked in mother baby. I've worked in triage. I've worked in NICU. So I have the medical component background of being a social worker in maternal mental health. I've seen the full spectrum from a mom trying to get pregnant to miscarriages, to perineal losses, to having that baby. I've seen the full spectrum of it. And it's really, like you said, a topic that is not discussed as much in the field of mental health, which is something that should be highlighted moving forward, especially with what's going on with COVID-19 now, where the experience is completely changed.
Well, I hope that this really is a catalyst for better care for this, very important population. So you recently became a mother. Congratulations.
Thank you.
How was your journey into motherhood?
So my experience, like I said, it may have been a little different from most moms due to my background for my career, as well as my knowledge of mental health. For me, when I found out I was pregnant, that excitement of being pregnant and having a child did not come immediately, because I was always fully aware of, one, the age of viability when it came to pregnancy. I remember when I hit that age of viability, it was a big celebration for me. And two, the fact that medically anything could happen. So for me, that excitement of being pregnant took a very long time to come. And it took a while for me to accept that I'm having a baby. So that transition was a little bit difficult for me in that, because I've seen so much. And then once I went through delivery, my delivery process was amazing. I have to thank the doctors and nurses and the whole medical staff that helped through my delivery process, because it was very, very good. One of the things that I did during my pregnancies, I stayed extremely, extremely active, which probably helped with my delivery process. And then postpartum wise, being fully aware of what postpartum depression is, being aware of baby blues, being aware of my maternal mental health, I took measures to ensure that I was taking care of my mental health postpartum.
Okay. Now, what systems are in place where you live for postpartum care?
There are many counselors and therapists who do focus primarily on postpartum care. I know one of the things that they do in the hospital before most moms leave the hospital is a postpartum depression scale, as well as when you take your child for their first doctor's visit and when you follow up for your OBGYN visit postpartum, they do a postpartum depression scale just to understand where you are mentally. 70 to 80% of new moms experience some sort of negative feelings, mood swings, or something of that nature after birth. So just fully understanding that, making sure that the parents are safe, mom is safe, and ensuring that they have the adequate resources in the community. We do refer a lot out to especially when I was in the hospital, we do refer to therapists, to counselors, to have moms seek outpatient counseling, because that is the main component that is available in the community right now.
Okay, nice. In my experience, not everyone does the whole postpartum depression at the pediatric level when you bring your infant in for their newborn screenings or any subsequent, visits. So that's very nice that, where you work and live, they're very aggressive with detecting postpartum depression. So you spoke a little bit about postpartum depression and baby blues. What are the differences?
So baby blues, according to the American Pregnancy Association, which is where I gather most of my information from, baby blues usually occurs a few minutes or a few hours a day. Symptoms are a lot less than postpartum depression. Baby blues includes weeping, crying, impatience, irritability, anxiety, some fatigue, some insomnia. You experience those mood changes, those moods of sadness, but it's not as intense as postpartum depression. So postpartum depression is the diagnosis did change because we did change to the DSM-5. So postpartum depression is the official mental health diagnosis for depression after having a child. So baby blues is just the feeling of it, and then postpartum depression is actually the diagnosis.
Okay. What about antepartum depression? Have you seen a lot of pregnant mothers or mothers to be experience depression during pregnancy?
That is true. Postpartum depression, I know they call it postpartum depression, which is basically after the child is here, but you can experience depression during your pregnancy. And keep in mind, there are also many factors that can go into that. So if you have a mom who has previously experienced a loss during pregnancy, that is a component that can contribute. If you're experiencing a mom who's not in necessarily a supportive environment that supports her pregnancy, there's that depression component of it. Or if you have a mom that just doesn't know what she's going to do postpartum wise with this child, there's that depression. So there are many components that can go into that can contribute to depression while you are pregnant. So it doesn't necessarily have to be after pregnancy.
Okay. Thank you for that tip. So as we move on to our questions, postpartum depression, peripartum depression, what are the prevalence rates? Who are at risk? What do we look out for?
Postpartum depression, the symptoms of postpartum depression are very similar to those of depression. The prevalence study suggests that over 30% of postnatal women have symptoms of depression, and between 10 to 15% actually meet the criteria for depressive disorder. So usually the onset typically is around 14 days after hospitalization. So, and then looking out for those symptoms that we described with the baby blues, they're very similar, where you have the weepiness, irritability, impatience, anxiety, fatigue, insomnia, sadness, those drastic mood swings, inability to concentrate, lack of connection with the baby. A lot of times is a telltale sign for postpartum depression is that connection with that baby's not there. So just looking out for those signs and being mentally aware as a mother of how you're feeling.
Okay. Now, pre-COVID, we touched base a little bit about postpartum care, especially as it relates to maternal mental health. What about the social determinants of health for those who are most at risk for depression?
What do you mean by that?
Like what things that are beyond the control of mothers that lead into depression, whether it be their legal status, if they're immigrants, or social economical situation? Do you find more lower income minority women more at risk, or is it those in the more affluent neighborhoods, or the middle, somewhere in between there?
From what I have noticed, it's very hard to say a particular socioeconomic status or a particular ethnicity is more at risk for postpartum depression, because it's something that we all, like many women, suffer from. There's no particular pinpoint socioeconomic status which can so the stress of a lower socioeconomic status can contribute to depression. So we're looking at two different components here. We're looking at the component of having the low socioeconomic status and not being able to support your child, which can lead to symptoms of depression. And then you're also looking at, okay, so you just had a child, so you have that postpartum depression component. So there are two different components when assessing for postpartum depression with that, just to ensure that you are assessing for the underlying circumstances for the depression are understood. Because it may not necessarily be postpartum depression that the mother is facing. It may be, I don't know how I'm going to feed my child. I'm not in a supportive family. I have no support. Those can all lead to depression.
Yeah. It's more circumstantial than a chronic thing.
Correct.
Yeah. Okay. So now that we're in COVID pandemic era right now, what ways do you think, or have you seen in your practice, that COVID-19 has affected moms or soon-to-be moms?
The experience is different. The experience of from your first ultrasound visit all the way to you giving birth, it's a different experience due to the precautions that have to be adhered to. Many parents do not have, especially when they go in for an ultrasound, they don't have that support there of their significant other. I've seen a lot of moms where they have to go to the ultrasound by themselves. So it is a different experience in that aspect. When you're in the hospital giving birth, after birth, you usually have family come to visit, friends come to visit. That experience is not there anymore. So it can take a toll on someone's mental health, and the fact that it feels as though you have no support while you're in the hospital. Which is technically, the support physically may not be there. And that's why I prefer the term physical distancing and not so much social distancing.
Yes.
Because we're not social distancing. We are physically distancing ourselves from others. So you still have modes where you can communicate, where you can be of support, where you can check in, reach out to parents or mothers who just had a child. Because like I said, their experience will be a lot different from a mother who had their child pre-COVID-19. So the fact that you don't have family to come and visit while in the hospital, even you go home. So you go home with your baby, and usually parents, the grandparents, aunts, uncles, nieces, they come and visit, friends come over and visit, but you don't have that experience anymore. That is taken away from you, and that can actually be a means to lead parents into postpartum depression. Because to be home with the newborn and not have physical support there to help you can get very trying at times. And if you don't have that ability to structure your day, or being able to have the experience of taking care of, if this is your first child, you have the experience of taking care of a child prior, you can actually be at risk for postpartum depression.
So with that being said, what are some ways that we as members in the mental health or physical health community, family members, friends, loved ones, what can we do to support moms as they transition to motherhood, regardless if we're in a pandemic or not?
Education. The lack of education and the lack of conversations as it relates to postpartum depression when a mom is pregnant. I understand it's a time of happiness, it's a time of joy, it's a time to celebrate, but not having that conversation puts them more at risk because they're not aware. So say, for instance, when you take the baby home and you're feeling down, you're crying more, your sleep disturbances, you're having difficulty bonding with your baby, you may feel alone because this conversation has not occurred. You're like, what is wrong with me? Why can't I bond with my baby? Not realizing that you are in a situation where you are experiencing postpartum depression. But because that conversation never occurred while you were pregnant, you feel as though something's wrong with you, which is not factual. So having these conversations while the mom is pregnant, even though it's a time of joy and happiness and celebration, you do have to have this conversation of what postpartum depression looks like and not stereotype families. So you see the mom and dad, they're married, happy couple, have support of parents, grandparents, so on and so forth. So you don't have the conversation with them because you say, well, they're quote unquote good family. That to me is doing a disservice to that mother. You need to have those in the medical field need to have that conversation with the parents regardless. So they're aware that when they go home, when they start seeing those early signs and symptoms, they can seek counseling and seek therapy and seek medical assistance early for early intervention.
And that is so important because a lot of women feel like they're alone. They're the only ones experiencing this, especially those who are going through miscarriages and other types of stuff where, it's actually a common occurrence to have miscarriages, but this is not spoken about. So people feel like, something is wrong with me. Exactly. And, that can weigh on a person's life forever. So mental health is something that's really, really important to be aware of, know the signs and symptoms of depression, know when to seek help, know when you need to get help for your loved one. So, let's see. So if there's something you could change about mental health care, what would it be?
The stigma. The stigma does individuals a disservice. It makes, and it's a lot of it is cultural. The stigma is cultural. And removing that stigma to say it's okay not to be okay. It's okay to seek help. It is okay to see a counselor. It's okay to see a therapist. It's okay to find someone that is not your family to talk about, especially when we look at the religious community. When we look at the religious community, the conversation is, well, I prayed about it. It's okay to pray about it and seek therapy. There's nothing wrong with that. So to me, the stigma associated with seeking therapy and seeking counseling, if there's one thing I could remove, would be that, to make it more a common circumstance. So when you feel sick, say if you have a cold, a cough, you have a fever, you go to see your medical doctor. I want that same application for when you're feeling sad, down, depressed, or you just want someone to talk to, go see a therapist. It should be just as automatic as going to see a medical doctor as it is to go see a mental health professional.
Why is it in the West Indian, Caribbean, diaspora culture that we as a people are so afraid to talk about mental health? It's so taboo,
That is a good question. Like I said, it's the stigma associated with it. There is, I don't know when it was generated, how it was generated. This is potentially a topic for future research in understanding why it's such a taboo conversation, why talking about your mental health is so taboo. It is beyond comprehension, because even when someone goes to see a counselor or a therapist, they do so in such a discreet manner that if you're seeing a therapist, no one knows. And then that kind of makes it hard to have open conversations about other people that are suffering with other mental health conditions. If you don't openly have that conversation of, yes, I was suffering from this and I went and saw therapy, it does not normalize that experience for everyone else. So the main thing in the West Indian Caribbean culture is to normalize that process of talking about mental health. A lot of people live with things within them that make it more devastating for them to go through life. And if they could just have that open conversation to develop those coping mechanisms to help them, then it would be an easier transition. But it's such a taboo topic that we suffer in silence.
And it's being magnified even more now with everyone being forced to stay home and if you're not an essential worker. Business is not popping like it used to. So a lot of, stressors are at play. So with this pandemic going for some uncertain time, what are some ways that you suggest that we can implement into our daily activities to help cope in a positive manner?
One of the notions that I like to talk about is the theoretical framework of mindfulness. Being aware of how we think, being aware of the thoughts that we dwell on. There are going to be moments during the COVID-19 where you're going to feel down, you're going to feel sad, you're going to be frustrated, and it's okay to be in that moment, but do not dwell in that moment. Having the ability to change your thought processing. One of the examples I give all the time is that a lot of people state they see being home as a negative. I can't go out to eat, I can't go out. But keep in mind, you're also spending more time with your kids. You're spending more time with your family. How many times in the past can you acknowledge having spent this much time with your family? Right? So looking at situations from a positive point of view instead of identifying the negative. Being mindful of how you process certain situations. It's very easy to dwell on the negative. It's very easy to identify the negative. But when you start looking for the positive within things, it changes your whole disposition. It changes the way you relate to things. It changes the way you interact with people. So just being mindful of your thought processing. In situations where there are times when it comes to the fact, especially with the COVID-19, where if you are unable to process through your thoughts, process through what's going on, you should seek help. If you're having suicidal thoughts, suicidal ideations, you need to seek help. Do not try to minimize what you are going through, because the pandemic, it is devastating to individuals' mental health. It can be. So seek help if needed.
Thank you so much for your advice and for this information, because a lot of people are looking for this sort of thing, So with that being said, where can people reach you if they need to contact you for your services?
Yes. So my agency is Inspired ED, inspiredcounselingcenter.com. You can go on there and you can fill out our contact card, or you can email me at Shaenor at SHAENOR at inspiredcounselingcenter.com. You could just send me, or I'm also on Psychology Today. So you can search me on Psychology Today, send me an email, fill out my contact card online if needed. And I will reach back out to you via email, and we could set up an appointment. If you need just one session, I can do that. If you want to set up a sequence of sessions, I can do that also. If you just need someone to process through what's going on in your head, we can do that also. You don't necessarily have to have an official mental health diagnosis to seek a therapist. And that is the misconception. A lot of people are like, well, I don't have schizophrenia. I don't have depression. I don't have an eating disorder. That's okay. But you are not feeling yourself. So let's talk about that. So to reach out to me, like I said, inspiredcounselingcenter.com, Shaenor at inspiredcounselingcenter.com is the email, or you can find me on Psychology Today.
Okay. Let's see your polo shirt so everyone can see your logo. There you have it, Inspired Counseling Center.
Yes.
Please check her out, inspiredcounseling.com, correct?
Inspiredcounselingcenter.com.
Center.com, okay. All right, well, thank you so much for coming on and sharing your information and telling us about maternal mental health. It has truly been an amazing discussion. I've learned a lot. And we look forward to having you for future discussions and panel discussions. And thank you again so much.
You're welcome.
Thank you for listening to today's Life as We Know It podcast. Remember, life is what you make it, so be sure to live it fully every day. Also, if you'd like to hear more of our topics or stay up to date with us, go ahead and subscribe to our channel and get notified each time a new video is added. Talk to you next time.